Well, hello everyone, and welcome to Upskills Unplugged, where we dive into essential conversations on healthcare, technology, AI, and business. I'm your host, Sharon Easterlin, Sharon E. And today's episode I am so excited about because we have a very involved guest in our community in trying to take us to the next level in health information and informatics, and that is Dr. Jasmine Agnew. We're going to be exploring the impact on health information and informatics related to AI and how we can improve ourselves within the profession. So, Dr. Agnew, I'd like to introduce you and just tell us a little bit about yourself.
Well, thank you so much for the opportunity to come. Again, my name is Dr. Jasmine Agnew. A lot of my friends call me Dr. J. I am a native of Baldwin, Mississippi, rural Mississippi. Um, I started in health information and technology with my associate degree in health information from Itawamba Community College. Went to work for a couple of years and then discovered that, you know what, from the advice from my mentors and then just my own discoveries in marketing, I need to go back to school. So I went back and did my bachelor's in health information management at the University of Alabama at Birmingham.
Wow.
Then came to Tennessee and got my master's in health informatics and information management from the University of Tennessee Health Science Center. And then after that, I went to seminary and got a degree in theological studies with an interdisciplinary concentration to learn more about program development in the communities. And then got my doctorate in health professions education. Have worked in healthcare for a long time before transitioning into academia. And then after working in academia in the associate, baccalaureate, and master's level, this opportunity came about where I was able to not only work with supporting educators, but also be an advocate for future proofing education and healthcare so that we could be abreast of what's going on in the healthcare ecosystem.
Oh my gosh, I love that, Dr. J. Future proofing. That's what it's all about, right? Looking ahead, how can we better prepare ourselves? So
Right.
I do love that. So you know what? Let's get unplugged.
All right.
Let's just dive right in. So tell me a little bit about, what are your thoughts? We're going to talk about AI first, Dr. J.
Sure.
Right? Since, I told you that's a focus that I've had. I think we as health information and informatics professionals can make a huge impact in that area. So what
Right.
are your thoughts on AI and shaping health information and health informatics?
I really think that right now there's a fear that AI is coming to take away a lot of our roles. But in fact, AI will be used to improve and augment our roles. It'll be used as a valuable tool so that not only will it be able to, you know, expedite some of our processes and help us be more detailed and gather more granular data. There's never a time where will not need that human touch. When it comes to what we do, it will be used to pull data and look at trends to see what service lines would be more profitable and meet the needs of our populations. Artificial intelligence is still artificial. There's still some things that you have to do to get it to work like you need it to. Some things that are beyond the what the human can do, but it is a tool that can help in extracting data and helping us to find processes to make things better. So I think that once we get past the fear of thinking that AI has come to take over and take our jobs and look at it as a tool, it can go beyond just HIM. It can go into medicine. Of course, it can be done in nursing to look at evidence-based practices to find protocols that work the best. And then when it comes to us, when it comes to revenue cycle, when it comes to how we keep our data governance, and all of those things that involve what we do as health information professionals.
Oh, wow, that's powerful. It is artificial, right? And I do think we do have a lot of fear. So when we hear, those comments that you're making, one thing I like to say, let's ease into it, right? Let's be curious, so we can figure out what the position is. We don't necessarily have to do that deep dive, but definitely all those things you say, makes it a fascinating evolution. You
Mm-hmm.
know, so from your perspective, how should education providers, handle kind of this transitioning with the AI?
Well, one of the things that I think that educators can do to, again, future proof is to work more collaboratively with external stakeholders or vendors that use those AI tools and then integrate those tools as we can into our curriculum. I think that working with those partners can teach us how to teach the workforce to use it properly and not only from the perspective of wondering what it means for our skill set. In fact, I really think that if we look at it for what it was developed for, AI can be used to expand our skill set because it does give opportunities for us to work more in the informatics realm and not just in mainline HIM, as we have always, sometimes pigeonholed ourselves into thinking. Being an AI informatics specialist gives you the opportunity to do a lot of data analysis, to look at big data, to look at the information that's produced by a healthcare organization and find ways to not only improve efficiency, but also improve revenue. And those are things that we need to know how to do as health information professionals because we were doing data management before data management was cool. When we had those carts full of charts. Now we know how to use technology, and this is just another emerging technology that can make our profession even better.
Oh gosh, Dr. J, so powerful. These are kind of our roots, right? And we're just kind of branching out more, and we need to
Mm-hmm.
look to those things and just build on it. I,
Right,
I love all of that. So
right.
just speaking of, our roots and, how we're kind of progressing here and getting back to the student. So how can students utilize the technology, you think, in their studies and future work?
Okay. The first thing is that I like to tell students AI as a tool and helping you to organize your thoughts, I think is very effective. And I think it's innovative. But do not depend totally on artificial intelligence to be your brain because, again, it's artificial.
Uh-huh.
Now, if you need to utilize it to help you to locate resources and locate other perspectives related to topics that we talk about in our academic programs, I think there should be use of AI in some of those methods because, it'll help them to become more equipped and help them to be more proficient when they do enter the workforce. But it should never be an opportunity for them to use it to do the work and then they just add their name. So our students need to use it as an effective tool to help to organize our thoughts, to help get us started in our own independent thinking on these concepts, but never as a replacement for the work that goes into the research goes into learning about HR.
Excellent advice using that independent thinking, using it as a store. After you put in some information, maybe, just helping you develop your thoughts, like you were
Mm-hmm.
mentioning. So I think that is great advice. So as we talk about our students, let's not forget about those great people, right, that provide students everything they need, the educators.
Right.
So, how can educators use AI better or prepare themselves better to understand it and teach some of these new tools?
Sure. Hey, as an educator, not only in the health information space, but also in ecumenical and religious studies, I use it to create scenarios so that we can use it for experiential learning, for we can use it for scenarios, for verbatims, for skits, to act out. When I'm teaching a class on conflict resolution, I would type in create a conflict or scenario,
Yeah.
identifying a conflict between a pastor and an angry church member about money and
Hmm.
it will give me just that. And I'm able to use that and we act it out. And it'll give you that hands on experience with it from a human perspective. Again, it's a tool. It's not made to replace your thinking or your human logic. It's made to help facilitate independent thought. In the same way, when we can say, hey, create a scenario where a hospital has gone through a natural disaster. Due to excessive flooding, the servers have been knocked offline. The system is no longer be able to be used, but the work does not stop. We still have patients being admitted. How do we continue with our workflow and use downtime procedures? Because a lot of our educators, especially if they're the old heads like us, but if they're the younger people, they've never been through that. And what they consider downtime was real time for us. That was how we ran the facilities anyway. How do they teach students how to apply what they know about documentation, about forms management, and about disaster recovery using these scenarios? Again, AI is a tool, not used to replace independent thought, but used to help facilitate thinking and to create scenarios to help people learn about skills needed in the workforce.
Oh, this is a very, very valuable conversation. I think very timely. I think something was driving me to have this conversation with you because you gave very good, simple examples of out of the box thinking for how we can use AI to improve ourselves. That's something I like to do. I like to teach how to prompt, right? And you were giving excellent prompts of the information that you need to feed AI to get results that you can educate yourself with.
Right.
That's what I love to talk to people about. So this is a great timely conversation. So what do you think, as far as what's going to happen in the field in the future, Dr. J? How do we move forward? What do you see happening as we move forward? Probably is a better question.
What I see and what I desire, what I hope is that we will reclaim our position in the field of health informatics because the base or the foundation of health informatics is patient data. Patient data is derived from a lot of what we do as health and what we manage as health information professionals. I think that you will see us expand and use our skill set in positions that are outside of just the traditional coding and HIM directors that some people have pigeonholed us into thinking that that's all we can do. We will work with artificial intelligence and reporting and data management and creation, policy creation, whether it has to do with the patients or the providers. I think that we will work to help hospitals determine what service lines need to be implemented based on the data that is pulled from the system. If you have a high number of diabetes patients, but you do not have a strong endocrinology or a strong diabetes management system in your hospital, use that data to determine, hey, this is what we need to do. Instead of doing Botox, let's do some insulin education for our patients. So I think that we will be used in a lot more, not patient facing, but patient relevant fields and patient relevant positions to where we use patient data to determine what needs to be the best, especially when it comes to precision medicine.
Absolutely, Dr. J. And, I like to talk about stepping into some of those other areas as well that aren't so customary, like, how are we going to be using this in privacy and security and compliance and, even release of information, right? Huge
Right.
impact there. So
Mhm.
I appreciate your time today, Dr. J. This has been inspiring. Definitely, I think something that all of our colleagues out there needed to hear. I'm sure this gave them lots of things to think about. Do you have any parting words of wisdom for us today before we leave?
The work never stops. As
Hmm.
HR professionals, we always need to stay on top of what's now, what's new, and what's next. Um, those continuing education is not just for you to get the CUs to maintain your credentials. It is for you to learn about what's going on in the healthcare ecosystem. Now, it's our responsibility on this side to make sure that it's relevant and make sure that you're getting what you need. But I hope that we will use this as an opportunity for us to learn about where the healthcare ecosystem is going so that we can future proof and we can be ready for the next wave of healthcare.
Oh, such great advice. I hope I can have you back at some
Anytime.
point. You have so much to say, and I think all of us need to hear those things, stimulate more conversation. Right? This is all about stepping into the future, doing new things, and learning new things. So, thank
Absolutely.
you, Dr. Jasmine, for participating in Upskills today, and thank you all for another episode of Upskills Unplugged. Remember, AI is more than just a tool, it's a shift in how we approach information and innovation. Join me next time for more conversations. Thank you all. Have a great day.